the latest sign of a healthcare system under strain, ambulances lined up waiting to transfer patients to overwhelmed hospitals.
During busier periods, there may be delays in responding to lower priority calls, while we respond to the higher priority calls.
Over the weekend, 50 Toronto ambulances were out of service at one time due to transfer delays caused by COVID. The result? Fewer paramedics available to respond to calls and a delayed response to others.
This is kind of a tragedy that we're seeing across the city that really is hard on our members and really kind of puts us in a moral injury type of situation.
The ripple effects of the Omicron wave affecting more and more people, from PCR tests being sent out of Newfoundland for processing.
Our capacity to deliver on those tests in-house was exceeded.
To Red Cross staff deployed to Nova Scotia to help with vaccination. Almost everywhere, healthcare workers are struggling to keep up.
We have a lot of patients and they're being bed spaced and we're doing the best we can, but it's obviously not ideal and we recognize that. So I think the ripple down effects are affecting almost everybody right now.
Canada's premiers on a call with the Prime Minister demanding more support during this crisis. Ontario's Doug Ford asking for billions of dollars in funding that Ontario could use to accelerate progress in delivering better care. His province still facing a weeks-long Omicron crisis ahead.
It's relatively likely that, somewhere in second half of January, we will see this plateauing.
He points out with PCR testing only available to a small portion of the population, it can be hard to make accurate modeling for the weeks ahead. Ontario's most telling data remains hospitalizations and ICU admissions, and both are still going up. Thomas Daigle, CBC News, Toronto.